centimeter wide and 3 centimeter in thickness. Okay. Okay, for an average male, your kidney will weigh 150 grams. In a normal male, your kidney will be weighed in 150 grams. In female, it is in 130 grams. Okay. So you have learned in lungs, your right lung will be shorter and broader and left lung will be narrower and longer. Same as in your kidney, your left kidney will be narrower and longer and your right kidney will be shorter and broader. So your right kidney will be shorter and broader and left one will be narrower and longer. And while looking into the locations, your right kidney will be always placed below the left kidney. Your right kidney will be always placed below the left kidney. Both will not lie in the same axis. Okay, your right kidney will be below the left kidney because that gap will be occupied by your liver. Okay, so that gap in your abdominal cavity, your peritoneal cavity will be occupied by the liver. Okay, shape, you know, it is bean shaped. Okay, so it is simple. So talking about the size, it is how many centimeters long? 11 centimeters long. How many centimeters wide? 5 centimeters wide. How many centimeters thick? 3 centimeters thick. Okay, so we are talking about the shape. Bean shape. Okay, so what is the location of your right kidney? It will be slightly below than the left kidney. Why? Because that gap is occupied by your liver. Okay, how will your right kidney look? Shorter and broader, and your left one will be narrower and longer. Okay, fine. Okay, fine. So next we will talk about the poles. Next we will talk about the poles. So you will be having two poles, the upper pole and the lower pole. As I told you already, your upper pole will be medially deviated or medially facing and your lower pole will be laterally deviated or laterally facing. Okay. So in poles you will be having two poles, upper pole and lower pole. Upper pole will be medially faced and lower pole will be laterally faced. Okay. Next we will get into the borders. So in borders, you will be having upper border, a lower border, a lateral border and a medial border. Okay. So you will be having a upper border, lower border, lateral border and a medial border. Okay. So your upper border, it is always covered by a gland. You know what gland this is? Adrenal gland. It is also called as suprarenal gland because it is present on top of your kidney. It is called as suprarenal gland. So your upper border is often covered by your adrenal gland. Okay. Your lower border will be facing your what? Always will be facing your anything? Okay. So that is something called renal pelvis. That is something called renal pelvis. Renal pelvis is nothing. It is the uppermost opening of the ureter. You know what is ureter? What is ureter? It is a tube which is connecting your kidney and your urinary bladder. That is ureter. Okay. So this renal pelvis is nothing but the uppermost extension of your ureter. Okay. So your lower border will be always having this ureter. Okay. And looking at your lateral and medial border, your medial border is convex and lateral border is concave. Medial border is convex and lateral border is concave. Okay, fine. Everybody understood this. So we are talking about the borders. We will be having four borders: upper border, lower border, medial border and lateral border. Your upper border is covered by your adrenal gland. Lower border is